Alien hand syndrome, also known as Dr. Strangelove syndrome, Strangelovian hand, or anarchic hand, is a category of conditions in which a person experiences their limbs acting seemingly on their own, without conscious control over the actions. There are a variety of clinical conditions that fall under this category, which most commonly affects the left hand. There are many similar terms for the various forms of the condition, but they are often used inappropriately. The afflicted person may sometimes reach for objects and manipulate them without wanting to do so, even to the point of having to use the controllable hand to restrain the alien hand. Under normal circumstances, however, given that intent and action can be assumed to be deeply mutually entangled, the occurrence of alien hand syndrome can be efficiently conceptualized as a phenomenon reflecting a functional disentanglement between thought and action, which is devastatingly frightening reality for the most part, because the foundational belief that your body belongs to you is challenged and disputed because that is in fact not the case. Dr. Chatterjee says alien hand syndrome is intriguing both medically and psychologically because having a sense of agency and control over our actions is essential to interacting in the world. Alien hand syndrome challenges the notion of what it means to feel ownership of your body, he says. First described in 1908 by Dr. Hugo Liepmann when he noticed a patient exhibiting an involuntary grasping reflex of the left hand after experiencing a stroke, alien hand syndrome can result from brain damage due to surgery, brain tumors, aneurysms, stroke, neurodegenerative disease, or trauma. A specific cause is not identified. Variations of it involve different regions of the brain, but it generally stems from disruptions in brain networks involved in movement and control. It is also called alien limb syndrome because it can occur in the legs as well. It is a rare neurological phenomenon. Limbs seem to have minds of their own. The condition can be distressing and can present in varying ways. One hand may swat at the other involuntarily, or an arm may inexplicably shoot into the air. In a report documented in the medical literature, a man's alien hand started undoing the buttons on his shirt as his other hand buttoned them. In other case reports, patients have said they awoke from sleep to find their hands choking them. Another case involved an 84-year-old woman who went to the emergency room because she had episodes during sleep in which her left arm moved as it were groping around trying to grab at her body. The bizarre movements also happened while she ate, watched TV, and went to the bathroom. She found herself talking to her hand or yelling at it to get it to stop making embarrassing movements, and she even worried that she might be possessed by the devil, according to the report. A CT scan showed that the woman had sustained a stroke. By the time of her 1-month checkup, the woman's alien hand had quieted down. Brain imaging showed that the stroke had caused a lesion in the man's left medial frontal lobe that extended into the corpus callosum, a nerve tract connecting the brain's right and left hemispheres, which likely was the root of the problem, Dr. Chatterjee says. The patient's involuntary hand movements became less frequent and less severe over time. Some people refer to their alien hands in the third person, as if the limbs were distinct entities from their bodies. They may even scold them as if they were naughty children. It's as if something else is controlling their hands, Dr. Chatterjee says. Part of your body is doing something you don't want it to do and getting in the way of doing something you do want to do. While not painful, alien hand syndrome can be frustrating and embarrassing for patients and their families. Our hands explore the space around us and provide information about the physical world and how we interact with it. It's bizarre to have a body part move around and do things you aren't asking it to do. While it affects children, usually the alien hand occurs in adults. This syndrome occurs more often when a patient is fatigued, stressed, or has divided attention between concurrent activities. AHS is divided into 3 variants: frontal, callosal, and posterior, based on their presentations and locations of brain impairment. The posterior variant can be seen after infraction in the thalamic, occipital, and parietal regions of the brain, while the callosal variant occurs after callosal injury and frontal variant after supplementary motor area, cingulate region, or corpus callosum injury. Doctors diagnose based on patient history and a clinical exam. They may also order brain scans to look for lesions. While there is no direct treatment, supportive care, including occupational and physical therapy, can help patients develop strategies to minimize interference from the hand. Cases caused by stroke may improve weeks or months later as patients recover. AHS is rarely encountered in clinical practice, making it unlikely to be considered in a differential diagnosis. However, this case illustrates AHS as the initial presentation of multiple cerebrovascular infarctions. There should be a low threshold of clinical suspicion for serious brain disorders in patients presenting with AHS. Awareness of the syndrome may allow for earlier detection and effective treatment of the underlying disease. There is no cure for alien hand syndrome. Therapies and pharmacologic options for alien hand syndrome lack development, but scientists are working on treatments to reduce symptoms. People who have alien hand syndrome after brain illness or a stroke may recover after some time. However, recovery is less successful for people with neurodegenerative diseases.